Good afternoon, ladies and gentlemen. Welcome to NH Dialogues. Today we are going to talk about one of the burning healthcare issue which is affecting millions of people in India and outside India. That is the epidemic of a disease called diabetes mellitus. There are perhaps over 400 million diabetics in this world. India currently has about 69 million diabetics. I'm sure it is a lot more than that. And India is likely to have close to 140 million diabetics by year 2040. It is a crisis. Is there something we can do about diabetes? Is there something we can do to prevent diabetes? And how do we know more about diabetes? According to me, as a heart specialist treating heart patients, for me there are only two categories of Indians. One is an Indian who knows he is diabetic and the Indian who doesn't know he is diabetic. Because half the patients we operate as heart surgeons, we do the bypass graft, 50% of them are diabetics. It is a scary situation, but interestingly, diabetes is a disease. Once you understand how the disease occurs, how you can manage, you can make friends with diabetes and enjoy your life. With that intention, we invited two of the stalwarts in diabetes, Dr. Satish Kumar, who is the head of the Endocrinology Diabetes and Bariatric Medicine at Narayana Health City. First time I came to know there is something called bariatric medicine from Satish. I always thought bariatric is all about surgery, but he told me that you can make people lose weight without undergoing operation. So welcome Satish. And Satish used to work as a consultant at the National Health Service hospitals in England a few years ago before he joined our health city. And now I want to introduce you to Dr. Prem Kumar Patidhar, who is the head of the Department of Diabetes at Narayana Hospital in Jaipur. Dr. Patidhar, I will be asking some of the questions which patients from all over the world have asked, and they have very, very interesting questions, and I would like to educate them. The first question to you, Dr. Patidhar, is about what are the types and causes of diabetes?
Yes. Types of diabetes, there are main category, three types of diabetes. One is type 1 diabetes, other one is type 2 diabetes, and third one is gestational diabetes. Type 1 diabetes usually occurs in children who have their pancreas that is not functioning. Beta cells in pancreas. Pancreas is a gland which is situated just behind our stomach. Beta cell forms insulin that is essential for life to digest our blood sugar. If we don't have beta cell, then we develop diabetes. This is the diabetes occur in type 1 diabetes in children. Second one is type 2 diabetes, which occurs in slightly elderly persons, like more than 20 or 30 years of age. In these patients, beta cells is there, insulin production is there, but the effectivity and production of beta cell is slightly deranged. So insulin is there, but the efficiency or potency of insulin is decreased. So these patients need extra support in form of medication to increase their insulin levels to digest sugar. That is known as type 2 diabetes. Third one is gestational diabetes, which occurs in pregnant women during their pregnancy because of hormonal changes. Usually it occurs between 24 to 28th week of pregnancy. That is known as gestational diabetes mellitus. Other diabetes are very rare. We will discuss only these 3 diabetes today.
Thank you. Thank you very much, Prem. And let me come to Satish. Satish, you know that diabetes is a painless condition. And most of the time, diabetes gets diagnosed accidentally. Patient goes for blood test for something else, and they find the blood sugar is 300. It's a very unfortunate event. We want to screen patients, or we want patients to ask questions about, am I a diabetic, and what are the symptoms I get if I'm a diabetic? And this is the question asked by Mr. Alok Kumar Kare from Gorakhpur. So he wanted to know what are the symptoms of diabetes before it occurs.
Well, you asked me a very good question, Dr. Shetty. Just for the viewers, it depends on the type 1 and type 2 diabetic patients. As we deal with majority of the cases are type 2 diabetics, when we are talking about diabetes, we are talking mainly about type 2 diabetes. And it is a silent condition. It can develop the problem for type 2 diabetes for nearly 5 to 10 years also without any symptoms. And yes, as Dr. Shetty says, we diagnose most of these conditions incidentally. They go for some other screening, some other investigation, we say that you have diabetes. And commonly, this condition can present with increased thirsty and increased urination. And sometimes if the condition is significantly higher and if the blood sugar is very high, patients can lose body weight as well, associated with generalized tiredness and recurrent fungal infections. Sometimes if somebody develops infection, it may not get cured very easily. These are some of the symptoms patient can come out with. And apart from this, patients, there are some families and they may have their father, mother or family members having diabetes. In such situation, they have to be very careful about when they get these kind of symptoms, immediately they need to contact the doctors and check for diabetes diagnosis.
Yes, Satish, it's very interesting. A friend of mine, he had ear infection. He took all kinds of antibiotics. It wasn't responding. Then the GP did a blood test and his blood sugar was 300. And
Yeah.
that's the first time. He's an educated person.
Yeah.
Incidentally, he's a doctor himself.
Yeah.
He realized he's a diabetic.
Yeah.
The Mr. J.R. Matthew from Mumbai has asked a very interesting question. Is jaggery, white rice and ripe banana good for diabetes?
Very good and commonly asked question. Jaggery contains 50% of sucrose in this and 20% as a inverted sugar. So jaggery contains at least 70 to 80% of the sugar in this ingredients. We should not take jaggeries because it will increase our sugar level as soon as we eat jaggery. This is contraindicated because this is labeled as a simple sugar. So we should not eat jaggeries in diabetic patient. This is not good for diabetic. Second one is white rice. White rice is also, it contains carbohydrate in form of simple sugar. We can take rice but in small amount. White rice, if we want to use it, we can boil the rice, we can remove the water from boiled rice and we can eat in a small amount. Third one is ripe banana. Ripe banana is a good source of fiber, protein and vitamin C, but it also contains carbohydrate. One small to medium sized banana contains around 60 to 70 gram of carbohydrate. So we should keep in mind that we are taking banana and we are taking this amount of carbohydrate. We should calculate the amount of carbohydrate. So we can take around half to one banana in a day. But we should add in our calculation when we are counting our carbohydrate. But this is at least, we cannot say that these three things are good for diabetics.
Prem, I'm very sad to hear Jaggery is not good for diabetes, or because I love Jaggery, and till fortunately I am not a diabetic yet, but who knows? My father was a diabetic.
Okay.
Yeah. Am I likely to become a
Yes,
diabetic because
yes.
my father was a diabetic?
Yes, if we have family history of diabetes, there is a more chances of developing diabetes, especially in type 2 diabetic patients.
Okay, I need to check my
So we
blood
have
sugar.
to maintain our body weight, and we have to keep our lifestyle healthy.
How often I need to check my blood sugar just to make sure that I haven't developed diabetes?
Yes, at least once in a year, after 40
Once
years
a
of
year.
age.
I'm okay. I checked
Yeah.
it 3 months ago.
Yeah,
Thanks, Prem. Thanks. Satish, there is a question from Mr. Yogesh Rao from Bangalore. He wants to know, for diabetes, insulin is good or tablet is a good substitute? Because nobody wants to get an injection.
Absolutely.
You know, taking an injection every day, twice sometimes, is not a very happy situation.
Yeah.
So what's your opinion?
It's a very good question. Whenever we diagnose diabetes, first thing patients will have fear in their mind would be injection. And as you have heard from Dr. Prem, there are different types of diabetes. In case of type 1 diabetes, there is no other alternative. All the patients must take insulin. Without insulin, you cannot control diabetes. Of course, apart from that, additional things like diet control, exercise may help those patients, but definitely not totally. And when you come to the type 2 diabetes, yes, initially the first treatment target which we look around would be changing the lifestyle of a patient, regulating their food habits, and the second thing, regular exercise. At least 20 to 30 minutes of exercise every day, 5 times per week is recommended. And apart from that, you have to reduce your body weight if you are overweight. And most of the type 2 diabetic patients are overweight or obese, and I think these 3 main things which we need to look into. Next comes the tablets, and if we cannot control blood sugar under the target, and with diet, lifestyle changes like exercises and food habits and everything, we go on to start tablets. And majority of them, and after 10 years, 15 years of all these things, they may require insulin. And I have few patients, 50 years of diabetes, still they are on tablets. And that depends on how their body reactivates to various medication, how their beta cell function is working. At the end of 5 years, 10 years, we make the decisions.
Satish, very interesting. My father, when he crossed 70, he didn't need any of the anti-diabetic drugs. Of course, he was very thin. Similarly, my father-in-law, past the age of 70, he was off every anti-diabetic drug and their blood sugar was perfectly controlled. Is it a common occurrence when you grow old, you don't need insulin or a tablet? Or it is an exception?
It is an exception, as we have seen quite a number of patients just now I told. And I have few patients, 50 years of diabetes, they don't require 2 tablets, 3 tablets. There are different types. And in some of the patients, they need insulin very early in their condition. And some of them, they require only tablets for a longer period. And some of them, they can control with diet alone.
Okay. Prem, there is a very interesting question which is close to my heart. This is from Mr. A.N. Thakur from Delhi. He wants to know the importance of exercise in diabetes. Do they need to exercise at all? And if they need to exercise, how often they need to exercise? And how important it is for a diabetic patient?
Yes, very good and very important question. I would say exercise and diet control is the first thing which should be done by the diabetic patient. Exercise can be done in any form, like walking is to be told as a best exercise. But in elderly patient, we should ask our cardiologist whether you can exercise or not, because some patients have cardiac problem, they have to restrict their exercise timing or activity, like strenuous exercise cannot be done. But in my opinion, the foremost and important thing before medication even, we have to exercise regularly, at least 30 to 45 minutes per day. The brisk, sorry, brisk walk is the best exercise we can advise to anybody. Exercise burns over glucose in the body. If I want to say, I can tell you one mechanism. If when we exercise, our glucose is digested without insulin. Our cells can utilize glucose without the help of insulin. So during exercise, we save our insulin for the next time, like next hours. Second thing, diet control is again important. We should avoid the things which have simple carbohydrate and junk foods, especially cold drinks, the food which contains simple carbohydrate like fast food, junk food, etc. So lifestyle is the important part of our management.
You know about exercise, Prem, I just want to inform all the viewers. There are tremendous benefit of exercise, especially in the morning. The greatest advantage is if you want to look young forever, if you don't want your skin to crease, and if you don't want to look old, you exercise. If you exercise, you will always look young and you will feel young. And if you want to remain very alert, very energetic throughout the day, exercise in the morning. Because when you exercise, in your body, there will be a release of a chemical substance called endorphin, which is like an opium. Yes. That will keep you excited whole day. So you want to remain young, you want to remain fit, exercise in the morning.
Yes.
Satish, Mr. Shivakumar from Kuppam, he asked a very interesting questions about hypo. One of the nightmare for all the diabetics is a hypo. We go for weddings, suddenly you see somebody fainting in the middle of wedding ceremony because his blood sugar is down. You go for some public function, you find people fainting. It's a very scary situation, especially for people who don't know, to see somebody just flat on the floor. How do you avoid hypo? And if it happens, as people, bystanders, what we can do or what patient can do to avoid it?
Yeah. Very interesting question. And without knowing hypo, and it's very difficult to manage diabetes. And this is one of the scary conditions every patient is afraid of. Just to let you know a few things about hypo. In the initial stages, all patients must know what is hypo, and if it happens, how they can identify in the initial stages. And the number of patients, if their blood sugar going down lesser than what we need, they start getting either sweating and hand tremors, anxiety, sometimes palpitations, headache, blurring of vision, and emotional lability, and patient can have other symptoms as well. These are all the initial features. As soon as you get these features, when you are on insulin or oral tablets, and you must get a sort of doubt whether am I going into hypo. If you have any glucometer, you can cross check and identify. If you do not have, you don't need to wait for checking. Immediately you need to start treating the condition. Treatment by means of either you can take simple sugar orally and drink some water, or milk with sugar you can drink. If you don't get, you can take juice. If you don't get, you are in a marketplace, or if you are on a street or somewhere else, if you can get some cool drinks like Pepsi, Coke, anything around 100 to 150 ml if you drink, within 3 to 5 minutes you feel much better. That itself is a sort of information that your body had low sugar, and after drinking this high sugary contents, you start getting better feeling. This is the second thing. And third thing, you need to identify why this happened. Without any reason, nobody can get hypos unless there are a lot of other problems. So initially you know how to identify, next one you know how to treat it, and that is the immediate treatment. After that, if you are in a meal time, take meal directly, or if you are not in a meal time, you need to take something solid which releases sugar in a slow fashion, because your insulin or the tablets will be causing again hypo within the next 15 to 20 minutes. And what you can take, if it is not a meal time, you can take an apple or a banana or 3 to 4 biscuits, something like that you can take. That will remain there until your next meal. As I said, the third point which you have to do would be why this happened. Most of the time you can identify. We usually suggest some insulins are taken 20 to 30 minutes before meal, some insulins are taken 5 to 10 minutes before meal. You would have taken insulin, but because of somebody, visitors came to you or some other work, you forgotten to take meal. That is one of the important causes of hypos. And the second thing, once you are on tablets, you have to regulate your meal timings. If you are not doing that, the second reason for hypos would be erratic meal pattern. And the third thing is, and sometimes you walk every day for 20 minutes, all of a sudden you started walking for 1 hour. That can cause hypos. These are the common things that happens in day-to-day life. Apart from that, if you can't identify anything, overdosage of either insulin or tablets. These are some of the things which are preventable and which you need to identify.
Thanks, Satish. Prem, you told me that I am vulnerable to develop diabetes because my father was a diabetic. Now, there is a question from Shalini Bansal from Pune. She wants to know, if one is vulnerable, how can they prevent diabetes?
Yes, a very good question. And this is the way we can change the prevalence of diabetes. We can say, you have told that 415 millions are living with diabetes worldwide. But we should see the patient who are vulnerable. In world, there are 318 million people are living with pre-diabetes. Pre-diabetes is a situation where patient has...
You mean to say I could be one of them?
Depends on the blood sugar level.
Okay,
if it is,
I'll check my blood sugar.
Yeah.
Okay.
So if somebody is having blood sugar level of in pre-diabetes range, like fasting sugar 100 to 126 and postprandial 2 hours after meal, that is 140 to 200, then these are labeled as a pre-diabetes. So we have to prevent these people to get diabetes. The best way to prevent diabetes is to change your lifestyle, to make it healthier. We can change our lifestyle by including healthy lifestyle includes like daily 30 to 45 minute exercise, brisk walk. Second thing is to eat only the things which are healthier to us. Should not eat the things which contains more sugar, more fat. So we can change our lifestyle. We should use stairs rather than lifts. We can change our lifestyle. The most important cause of developing diabetes and getting fat is availability of meal. Nowadays, we are seeing that whenever we go, we first eat, then go to the market. So availability of meal is the biggest issue. So we should eat only things which are healthier to us, and we should eat for our maintenance of the life. We should not eat extra calorie for taste only.
Prem, you are saying that don't eat for the sake of enjoyment, eat it for the sake of survival.
Yes, not enjoyment, but we should eat the things which are unhealthier in small amount, and the things which are unhealthier, like contains junk food, contain excess sugar, we should eat only occasionally.
Sure. Satish, Firdos from Dhaka, Bangladesh, she asked a very important question regarding her son. He is a 7-year-old kid taking insulin 3 times a day. Is there any alternative? He's a juvenile diabetic, of course. For a kid to take injection 3 times a day, it's a very painful condition.
It is single most important question that bothers every parent throughout the world. And in fact, we have received calls from US where quite a lot of research and everything is going on. As soon as they found their child is having type 1 diabetes, they called us, is there anything in India which is available? And for that, answer for that would be insulin is the only treatment for this condition. Having said that, we can make some alterations in the insulin regimen, and depending upon the condition and status of the child. For example, minimum of 2 injections per day is very essential for all type 1 diabetic patients. And at that 7 years old, and we need to take consideration about the independence of the child. I don't think the child by itself can take injection. So parents' involvement is very important, and they have to organize all these things. And the second thing would be the child's life can be made little bit easier and enjoyable by communication. What I mean to say is communicating with the school nurse and school health worker, school teacher and sports teacher. If we communicate all of these people and allow the child to go to various diabetic camps, so that they will understand how well all these things are coordinated. And only problem with parents would be, and how about my child takes injection when the child is in the school, and how about injection when the child is in some sports event. And all these things can be coordinated when we have a coordination with a sort of group sort of approach to this management.
Thanks, Satish. One of the interesting question is asked by Arohi Soni from Vadodara, Gujarat. She's only an 18-year-old girl, and she has diabetes, and she says, looks as if she's having a miserable life. How can you make the diabetic's life enjoyable?
Yeah.
You're putting so many conditions.
Yeah.
Is there some way they can enjoy life, and being a diabetic they can enjoy life? Is it possible?
Yes, it's a very, very interesting question for all the people who are at this age, because they are slowly transferring, that is changing from a childhood to adulthood and then entering into the independent life. And at this age, quite a lot of them are independently joining their work places. And this is one of the important questions. Yes, diabetic patients can enjoy their life if they can slightly reorganize their life schedule. For example, and as I was telling, there are 2 injections you can take. If you take 2 injections in the afternoon, there is no one in the morning, one at night. Afternoon, sometimes you may not be in a position to take insulin. You may be at your workplace. You have a lot of inhibitions to take insulin at your workplace. First thing I would suggest, depending upon your work schedule, depending upon your relationship with your close colleagues, and you can reorganize everything. We have different regimens of insulin we have. That is one aspect. And the second thing would be, we have insulin pumps, and at this point of age, you can independently reorganize your insulin regimen. You don't need to depend on parents. And for them, insulin pump would be ideal. It is a pump, and it contains a cartridge containing 300 units of insulin. There is a simple cannula which you can insert into your anterior, that is abdominal wall, and you can carry on doing it. There are computed sort of insulin adjustment regimens which we can adjust. Continuously it keeps on giving insulin throughout the day. Whenever you are having a meal, you can take pump insulin, that is a bolus of insulin, depending upon what you are eating. And in the same way, even when you are exercising in the gym, you can readjust your insulin dosages, and you can readjust your carbohydrate intake, and so you can have a sort of lifestyle what you want, and you can go for exercise. And sometimes these pumps can be just removed temporarily for half an hour or something, even if you are swimming, even if you are taking bath, and you can do whatever you would like to do.
Thanks Satish. Prem, there is a question from Mr. Musa Khan from Bangladesh. It's a very interesting question. I'm sure most of the viewers may not like to ask the question. He has a very clear, he wants to know one thing from you. He is diabetic, can he drink?
Yes, very interesting question.
Diabetics, can they take alcohol?
Yes. There is a relation between diabetes and alcohol. First, I will summarize what is the relation. Alcohol has their effect on various organs in the body. It causes effect on liver, pancreas. Pancreas has beta cells, so excessive alcohol intake can cause chronic pancreatitis. It can lead to diabetes itself. That is known as pancreatic diabetes. Second thing, if we take alcohol in small amount, small drink, 1 or 2 drink per day, then it can cause hypoglycemia or hyperglycemia depending on the situation. Like if we are taking alcohol with snacks, it will be okay. If we are taking alcohol empty stomach, it can cause hypoglycemia by affecting the insulin secretion and its action. But if somebody wants to take alcohol, red wine is better than other white wine or whiskey. Second thing, we should eat after alcohol intake. So in night time, we should not go into hypoglycemia. So we should keep watch on hypoglycemia and hyperglycemia, but otherwise, if somebody wants to take alcohol, he or she can take.
Sure. Satish, Nitya from Mysore wants to ask a question which most young ladies want to know. She's 36 years old and she had gestational induced diabetes. She became diabetic during pregnancy, during a second pregnancy. So is she vulnerable for developing diabetes later on in life?
Yeah, and this is one of the important questions. Yes, and people who have had gestational diabetes, that is diabetes during pregnancy, they are at high risk of developing type 2 diabetes in the future life. And what we normally tend to do after delivery, we try to check blood sugar 24 to 48 hours to see their blood sugar has come back to normal. If it has come back to normal, we advise oral glucose tolerance test. It is a test by which we do the blood sampling after giving glucose liquid. And exactly 6 to 12 weeks after the delivery, that gives us some information about whether the patient is normal at that point of time, whether patient is pre-diabetic, that is abnormal blood sugar at that time, or frankly diabetic. After that, we plan our future planning. If somebody is normal, we tend to cross-check their blood sugar or oral glucose tolerance test once in 3 years in the future. If their blood sugar is in a pre-diabetic or abnormal state, and we tend to check their blood sugar every year to identify what's happening. And if they are frankly diabetic, we start the planning for controlling blood sugar at that point of time.
Thanks, Satish. The Prem, Mr. Ramesh from Bangalore is concerned about his son. His son is very obese. He wants to know whether he can become diabetic.
Yes, this is the important problem. The childhood obesity is gradually increasing day by day. This is a new epidemic which is coming in our country and in other growing country, in even developed country. So if childhood obesity is there, the insulin resistance will start in early childhood, and it can cause early failure of pancreas, and it can lead to development of diabetes. But at the time when the child is at the age of 16 or 18, we cannot say that he or she will develop diabetes or not. But if he is having family history of diabetes, he is obese, having black linings in the neck, that is known as acanthosis nigricans. If he or she is having acanthosis nigricans, chances of development of diabetes in future is very high. So to prevent for the development of diabetes, we should advise healthy lifestyle and to decrease weight And obesity is the most important cause for development of diabetes.
Thanks, Prem. Satish, this is the last question from Dr. Chandra Prakash from New Delhi. How best to treat erectile disorder in a diabetic person not responding to Viagra?
Very interesting question, which a number of patients do not ask us directly, but even though they have the problem, unless we prompt some questions, they wouldn't ask us. Erectile dysfunction is one of the important problems which we face in diabetic patients. And erectile dysfunction, when they say, we need to differentiate, because we need to differentiate three different things: whether there is a loss of libido, whether there is an erectile dysfunction per se, or premature ejaculation. And we need to evaluate the patient, and for all the three conditions there are different reasons. And when we talk about diabetes and erectile dysfunction, there are different reasons. These patients may have hyperglycemia, high blood sugar, that itself can cause other problems, and hypertension and neuropathy and vascular problems, that is involvement of the blood circulation. All these things can be involved in erectile dysfunction. And apart from that, we need to know some of the tablets like beta blockers, and people who have depression and anxiety problem, they may have psychiatric medication. They themselves can cause erectile dysfunction. After evaluating one by one, we need to look into whether this patient has testosterone deficiency or not. We check that as well. If they have testosterone deficiency, they may not respond to Viagra and other tablets which are available. First we need to treat testosterone treatment, and then they may respond. Say for example, if the patient does not have testosterone related problem, and the patient is not having any heart related problem, and they are not on any other medication, they are just erectile dysfunction and not responding to Viagra, and I think they have to speak to the specialist people and in the hospital to do further evaluation to see what is exactly happening. And we have other medications like if Viagra is not happening, and there are tadalafil is there which we can use, or there are devices like intraurethral alprostadil, that is one of the medication which we can use, or we can use vacuum pumps. That is one of the important things that is coming out in all the places, that can also be used.
Thank you, Satish. I would like to thank both you and Prem for educating our patients, especially the one who suffer from diabetes. And I hope those who are not diabetics are watching this program, and I'll pray to God that you will never become diabetic, so that you don't need the services of these two great men sitting here. Thank you very much. I'm extremely grateful to all of you for watching NH Dialogues, and looking forward to see you again in the near future with a new set of NH Dialogues. Thank you.